Bismillahirrahmanirrahim. Welcome to OcularDDtalks, which is a discussion of all common ocular disorders organized by Eye Healthcare Society. With the topic glaucoma, and this is me, Maryam Fida from BS Optometry and Orthoptics Third Professional from FMH College of Medicine and Dentistry, Lahore. Discussing about my topic, I'll describe about what glaucoma basically is. Glaucoma is a chronic progressive optic neuropathy caused by a group of ocular conditions which leads to damage of optic nerve with the loss of visual function. Because it has no early symptoms, eye docs call it the snake tip of vision. Most common risk factor is raised intraocular pressure above 25 mm of mercury. Normal eye pressure range from 12 to 22 mm of mercury. Optic neuropathy results in damage to retinal ganglion cells and surrounding tissue structures. It is a multifactorial optic neuropathy with visual field defects and change in optic nerve head. As more optic nerve damage occur, blind spots begin to appear in your field of vision. You probably would not notice these blank spots in day-to-day life until the optic nerve gets significantly damaged and spots become large. If optic nerve is severely damaged, that eye go blind. What is the reason of glaucoma? Common factor of raised IOP is obstruction to drainage of aqueous humor through the anterior chamber angle and at pupil. Aqueous humor. What is aqueous humor? Aqueous humor is an optically clear, slightly alkaline ocular fluid that is continuously formed 2.5 microliter per minute in humans from plasma by cells of ciliary body, epithelium basically. Aqueous humor is produced and secreted into the posterior eye segment, passes through the pupil into the anterior chamber. It is drained into the venous blood circulation via the trabecular meshwork and the canal of Schlemm. In open-angle glaucoma, fluid doesn't flow freely through the trabecular meshwork, causing an increase in intraocular pressure as the fluid accumulates in the anterior chamber as well as in the vitreous chamber and thus increase the intraocular pressure and damaging the optic nerve. As optic nerve get damaged, vision loss. Classification of glaucoma includes basically two types: acquired and congenital. Acquired classification is further primary and secondary and is further divided into again to open angle and closure angle. I am discussing about the congenital or infantile glaucoma. As its name indicate, appear between birth and age of 3 to 4 years, and intraocular tension is rare since birth. The etiology includes the congenital abnormality at anterior chamber angle, maybe due to failure or abnormal development of trabecular meshwork. Iris is not completely separated from cornea, persistence of embryonic mesodermal tissue at angle, and absence of Schlemm canal. Incidences include, as its name indicates, it present at birth. Symptoms may manifest within 1 to 3 years, and boys are affected more than the girls, and it is usually bilateral. Symptoms include the lacrimation. It is present due to corneal edema and erosion, photophobia, reduced visual acuity, and enlarged cornea and eye as a whole due to scleral stretching. Signs include the globular cornea with enlarged eye, corneal edema and opacities due to endothelium damage and Descemet's membrane rupture, deep anterior chamber with iridinosis and atrophy of iris in late stages, flattening lens and backward displacement due to stretched zonule of zinc, thinning of sclera and bluish as uveal tissue shine through it. Acquired glaucoma basically divided into primary open angle and primary angle closure glaucoma. Primary open angle glaucoma is chronic, slowly progressive condition, which it is genetic basis, and there occurs sclerosis of trabecular meshwork, and there occurs sclerosis of endothelial lining of Schlemm canal. Incidences include age that affect it is mostly 6 to 7 decade and affect both sexes and more severe in black people than in white. and first degree relatives are at risk and is more common in myopes. Sign and symptoms include because of all the silent nature of glaucoma, patients usually don't present with any symptom or visual complaint until late in disease course, particularly with primary open angle glaucoma. Primary angle closure glaucoma is intraocular tension raised due to narrow or closed angle of anterior chamber. Obstruction to outflow of aqueous humor, peripheral iris move forward to block the opening of trabecular meshwork at angle. Its etiology is again the genetic basis and small and hypermetropic eye, anatomical narrow angle of anterior chamber, shallow anterior chamber, iris length diaphragm is pushed forward. Incidences include mainly affect in 5 to 6 decades of life, and women are usually affected cause ocular volume in female is 10% less than that of the men with shallow anterior chamber. It is usually bilateral, and high-strung anxious person with unstable vasomotor system get more affected. Its symptoms include severe eye pain with sudden pain and blurred vision, bright halos appearing around the object, eye redness and hardness, feeling nauseated and vomiting. There is the comparison between the open angle and closed angle glaucoma. In the left picture, it is the open angle as iris and anterior chamber and cornea is at their proper on their proper place, and in the right image the iris is sticked to the posterior surface of the cornea and blocking the way or passage of the aqueous humor. In open angle glaucoma, there is obstruction to trabecular meshwork, and so there is blockage for the drainage of aqueous humor. And in the right picture, there is angle closure glaucoma that is describing as iris and lens are stitched together. Pressure pushes iris, blocking trabecular meshwork and leading to raised of intraocular pressure and getting damage to optic nerve. Absolute glaucoma is in which eye is completely blind with raised intraocular pressure, and symptoms include painful eye with no perception of light. Discussing the signs, there is a ciliary congestion around the limbus, cornea is clear and insensitive with vesicles or filaments, and uh, shallow anterior chamber, atrophic iris, white patches, broad zone of pigment around the pupil, and due to fibrosis of iris tissue. There's gray, dilated, and vertically oval pupil. Secondary glaucoma is due to a specific anomaly or disease of the eye. Its etiology includes inflammatory glaucoma, post-inflammatory perforation of cornea, massive intraocular hemorrhage, lens intraocular tumor, venous obstruction, or any obstructive glaucoma. Signs and symptoms are same. Aphakic glaucoma is the type of glaucoma which occur following extraction of lens, means cataract surgery. Etiology is due to delayed formation of anterior chamber, vitreous protruding through pupil in anterior chamber cause pupillary block. Malignant glaucoma is aqueous misdirection syndrome. It is a rare condition, may occur as complication of any intraocular surgery. And its etiology include patient with PSCG operated for peripheral buttonhole iridectomy or tubulotomy and aphakic eyes following vitreous phase disturbance. Its signs include flat anterior chamber following intraocular operation, raised intraocular pressure in early postoperative period. What is the treatment? First, we go to medicines. Prescription of eye drops are most common treatment. Then there is laser treatment. To lower pressure in the eyes, doctor can use laser to have the fluid drain out of your eye. And the third one is the surgery. If medicines and laser treatment don't work, your doctor might suggest surgery. Thank you so much for watching this video, and if give a thumbs up if you really like it, and subscribe to our channel. Thank you.